Hello, fellow pet lovers and curious minds. Today, we're addressing a common myth that often concerns cat owners, especially those expecting a baby. Do cats cause infertility? Let's dive into the science and separate fact from fiction. Understanding Toxoplasmosis is a common disease that can be transmitted from pets to humans. It's often associated with cats, but let's clear up some misconceptions. Myth: Toxoplasmosis causes infertility. One of the widespread misconceptions is that toxoplasmosis leads to infertility in women. However, there is no scientific evidence to support this claim. Extensive studies have shown no direct link between toxoplasmosis and infertility. Fact: cats and toxoplasmosis. Cats can carry the Toxoplasma gondii parasite, but they don't show symptoms of the disease. The role of cats is limited to the germ multiplying in their intestines, after which they shed the eggs, oocysts, in their feces. These eggs take 1 to 5 days to become infectious after being excreted. Therefore, direct contact with clean cats poses little to no risk to pregnant women. How is toxoplasmosis transmitted to humans? If the oocysts become infectious, they can survive in the environment, soil, water, vegetables, for months. Humans typically contract toxoplasmosis through eating contaminated food, consuming fruits and vegetables that have been exposed to contaminated soil or water, consuming undercooked meat, particularly lamb, pork, or beef that contains the parasite. Handling cat feces, especially if hands are not washed properly afterward. Symptoms of toxoplasmosis in humans: most people with toxoplasmosis experience no symptoms. However, in a small percentage of cases, symptoms can include temporary swelling of the lymph nodes, especially in the neck, accompanied by fatigue. In more severe cases, symptoms may include a fever, enlarged spleen, and liver. Can pregnant women keep cats at home? Yes, pregnant women can safely keep cats as pets if they follow a few precautions. Pre-exposure immunity. If a woman has been exposed to toxoplasmosis before pregnancy, she likely has immunity that can protect her fetus. Testing for immunity. Women can have their immunity levels tested before becoming pregnant. If they have immunity, there is no risk to the fetus. Transmission from mother to fetus. The risk of toxoplasmosis to the fetus arises if a woman is exposed to the parasite for the first time during pregnancy. The parasite can travel from her digestive system to the placenta, potentially affecting the fetus. The risk varies depending on the stage of pregnancy. First trimester, lower chance of transmission but a higher risk of miscarriage. Last trimester, higher chance of transmission but a lower risk of miscarriage. Symptoms in the fetus can appear years after birth and may include eye and nervous system issues. How to control and prevent toxoplasmosis. To minimize the risk of toxoplasmosis, follow these precautions. Regular vet checkups. Have your cat tested for toxoplasmosis regularly. Check immunity. Pregnant women should check their immunity levels. Avoid new cats. Don't acquire a new cat during pregnancy. Limit contact with strays. Avoid contact with stray cats and their waste. Safe waste disposal. Pregnant women should avoid changing cat litter or use gloves and wash hands thoroughly afterward. Daily litter disposal. Dispose of cat waste daily to prevent the eggs from becoming infectious. Hygiene practices. Wash hands after gardening or handling soil or sand. Cook meat thoroughly. Ensure all meat is well cooked. Use separate knives and cutting boards for meat and vegetables to avoid cross-contamination. There is no evidence that cats cause infertility, and with the right precautions, you can safely enjoy the companionship of your feline friend during pregnancy. See you in the next video.